Welcome everyone to our Healthy Living event on heart health. Now you're going to get tools today to protect your heart, and you'll also have the opportunity to ask interventional cardiologist Dr. Dwight some questions right here live. Dr. El-Khattab is the Director of Interventional Cardiology here at Hurley Medical Center. We only bring you the top experts. He's also board certified in internal medicine and cardiovascular disease. He completed his residency at the world-renowned Cleveland Clinic and had dual fellowships at Boston University Medical Center and the University of Connecticut. He's also teaching our next generation of doctors at Michigan State University. If you have questions for Dr. El-Khattab, he'd be happy to answer them live following his presentation. You can text me, text, not call, 248-935-2562, or post your questions on Facebook or YouTube. Dr. El-Khattab?
Well, thank you very much for having me here, giving me the opportunity on behalf of Hurley Medical Center to address a very important topic about heart health. I think it's something that's on everybody's mind. However, I'd like to take it down back to the origins and ask everybody to consider what is the heart. Now, you can look at the heart in so many different ways. You can say it's just a body organ right behind the sternum. Some call it a rather dry variety meat. Some think about it more passionately as being the center of their feelings and emotions. But it's truly just more than that. It is truly the most vital part of any human life. If you think about it, every organ in your body takes rest. The brain goes to sleep, the muscles can relax, but one organ just never stops working at any point and rather continue beating all the time, and that is your heart. If you held up your hand and tried to keep going at it in probably a couple of minutes, the most fit of us will be tired. Just think that your heart starts beating when you are born, literally never stops for the rest of your life, not for any fraction of a minute. Now, I'm going to start with a story that might be familiar to any of us, that we've heard it many times. This patient who is 65 years of age has, common risk factors: high blood pressure, high cholesterol, and while playing some golf, rather started feeling some burning in his chest. Now, this patient blamed it on him eating a hamburger earlier, maybe having some extra onions in it, took something to reduce his acid reflux, and around dinner time, he just continued to feel uncomfortable. This is a true story. This gentleman woke up at 2:30 a.m. in the morning, and when he sought medical care, an EKG was done, and it confirmed having an acute heart attack that we call an ST elevation MI. That usually refers to a completely blocked vessel. What did the doctors do at the time? They gave him painkillers. They gave him morphine. And for the next 9 hours, they did nothing. Now, I'm cheating a little bit because this is a rather old story. This was a very, very important patient. He was none other but the 34th President of the United States, President Eisenhower. This was an incredibly eye-opening story because he was rushed for an oxygen tent. A doctor, now very well known, Paul Dudley White, he was summoned in to help the president, and he recommended that the president be given anticoagulants, blood thinners, to maybe thin the clot that was closing the blood vessel. After that, he was confined to bed rest for almost 7 weeks because these were the only tools that we had back then. Dr. White actually went on to be the founder of the American College of Cardiology, finding out how necessary it was to have a body to make recommendations about heart health. So what happened? Basically, as you can see on the screen, there's a schematic of the heart. And the heart is a pump that requires nutrition that comes through the 3 blood vessels that we call the coronary arteries. And when one of them is completely blocked due to a buildup of what we call plaque, then ultimately it can slowly narrow the blood supply, or maybe if there's a crack in the plaque, that will require a lot of reactive, inflammatory cascade, and platelets that will ultimately close the blood vessel completely and cause the acute heart attack. Now, if you look at this current picture, this shows you the heart muscle, obviously, after a heart attack has taken place and after damage has happened basically to the infralateral wall of that pump, that muscle. And you can see how dark it is, and it becomes ineffective. And this is the start of what we call congestive heart failure, because part of the pump is not working. Secondly, this area that is necrosed and literally dead, it is a big nidus for abnormal heart rhythms that we call arrhythmias, some of which are the cause of death. So how common is heart disease? Well, for years and years and years, the debate has been, what is the leading cause of death? And nothing beats heart disease as of yet. Maybe if you combine all the cancers together, it will come as a close second. But truthfully, heart disease is still the leading cause of death amongst men, women, people of any different racial or ethnic backgrounds of groups in the United States of America. One person dies every 36 seconds because of heart disease, and about more than 500,000 die from heart disease every year, but 1 every 4 deaths is attributed to heart disease as well. The cost of taking care of those patients and the cost incurred by such calamity and death is astronomical. Why is this important? Because this prevalence of heart disease is, in fact, across all ages, whether people are over 80 or even in their 40s or 30s, there is still a high impact of heart disease on their life. And it is actually the leading cause of death, whether you are a male or a female. So we can't really blame it on gender, background, race, or ethnicity. And it is important because the cardiovascular system reaches every part of the human body. And any complication in the blood vessels, whether it be it in the heart, in the brain, down in the abdomen, or lower extremities or upper extremities, it's going to affect our livelihood and it's going to affect our health in a terrific way. Now, heart disease comes in a great variety. The most important of which and the most impactful of which is coronary artery disease, which refers to blockages in the arteries that supply blood to the heart, commonly called as heart attacks. But even heart attacks have a different variety. There's the very acute, what we call the ST elevation MI, or the non-ST elevation MI. There's the chest pain and anginal symptoms that we call unstable angina or even stable angina. When the heart muscle gets affected, whether because of blockages or for many other reasons, and the heart muscle gets either weak or stiff, we end up with a condition called congestive heart failure. As I've alluded to before, also diseased heart muscle can have a lot of arrhythmias, abnormal heart rhythm, which are very, very common amongst the old and the young, in fact. Stroke, when the heart is not working or functioning properly, whether due to an abnormal heart rhythm, commonly known as atrial fibrillation, or due to the presence of clot in dead areas of the heart, that can lead to clotting in the brain, and that can cause stroke and disability. Peripheral arterial disease, when the blood vessels in our legs or our arms are blocked, or the carotid arteries that go to the neck, that can also lead to major dysfunction in multiple organs and limitation in our ability to live the way we would like to live. So what causes and leads to these terrible consequences? Well, these are the usual suspects, which is what I like to call them. Hypertension, high cholesterol, smoking, diabetes, obesity, sedentary lifestyle. And one thing we cannot change, or we think we can't change, is our genetic predisposition to the disease. So what is the percentage of US population that has more than 2 risk factors? I'll draw your attention to the part of the screen on the right side, and that was even in 2003. It almost was everywhere, and I truthfully think now it's everywhere. And it's at any different age. Where if we talk about high blood pressure, well, there is an incredible prevalence of hypertension. Now the good news is we have good treatment for high blood pressure, but if we fail to address it early and persistently, then we are failing to treat it and to stop it. High cholesterol. Well, genetically, some of us are predisposed to have high cholesterol. But our diet and our lifestyle interferes with that quite a bit and does not help it. The one message that I'd like to get through is people commonly tell me, I have a normal cholesterol. And in fact, those numbers are very relative. What is normal for one patient may not be normal for another. The real question that we should ask is your current level of cholesterol optimal for you? This is individualized, and this is why the patient themselves should be asking those questions to their doctors. Now, obesity and sedentary lifestyle is extremely common. Unfortunately, our weather doesn't help as well in Michigan, so we don't take those outdoors activities as often as we should, and when we don't actually apply it in our home as much as we should. Smoking is the big elephant in every room. Now, there's been a good move in the past few years for many people to quit smoking or not even start, but unfortunately with the advent of other methodologies that use nicotine, we're finding a resurgence of that, and that's truthfully very, very impactful on increasing the prevalence of heart disease. Now, is there hope? Is there good news? I tell all my patients that the reason you should come to your doctor and the reason you should see a heart doctor if you need to is not to be anxious and is not to be sad. Rather, it's quite the opposite, is to change the narrative so you are happier and you have much more hope. Well, part of the good news is that the adjusted death rates from coronary artery disease in the United States has been falling steadily. And that's because a lot of good treatments are there and a lot of smart people are listening and they're trying to get themselves better. You get the picture of what it is. Let me explain to you again what's happening in the arteries. On the left side top picture, you see a smooth lining of the innermost layer of the healthy blood vessel. As time goes on, there's a fatty buildup inside that innermost layer that makes the lumen smaller. And when that happens and we exert effort and the heart requires more blood supply, more nutrition, it is not getting it, and that leads to chest pain and other problems. Also, if that plaque ends up exposing its contents to the bloodstream due to a crack in it, the etiology of which is not 100% known, but there's a lot of factors that lead to it, whether it's stress, smoking, a viral infection, or many other things. The end result is when that happens, a quick clot forms to heal that crack, but ends up closing the vessel, unfortunately. So we talked about education of what this is. Let's move on to say, how can we prevent any of us from getting into that end result? You got to ask yourself a few questions. Am I diabetic? What are my risk factors for heart disease? Have I been checked for them, and have they been managed? And is my doctor doing everything they can to change that risk? An advice from me today that I give to myself, I'll say, sleep well, exercise, the least of which you can do is walk, which is, by the way, very, very effective if you do it for long enough, and exercise your brain. Keep a healthy outlook. Eat better food. Now, the debate on what is better food has been going on for a long time. I don't think anybody disagrees that eating fish is good for you and eating more fruits is good for you. Like I said before, have a positive attitude to life. Know that you're going to your doctor so you can get better, and be proactive in your health. Many times I tell my patients, when I ask them this silly question, who cares about you the most? And the answer I'm looking for from them to say is, I do. You should care about yourself more than anybody else because you have to bear the consequences. Therefore, you need to know what to do more than anybody else. It is never too late to take that role. This is what I hear also from some patients that will say, well, I already had a heart attack, I already have the problem. But truthfully, it is never too late to get better, because we have shown through many clinical trials that you can improve your outcome and improve your result, improve your lifestyle, sometimes by cardiac rehab in one manner or another, and improve the potential for getting a second event by doing the preventative things that we're going to talk about. it starts with knowing your numbers. And while I have numbers on the screen for cholesterol, I remind you of what I said earlier. Cholesterol is not one size fits all. It has to be tailored to what your health is and what your risk factors are. Know your numbers about your blood pressure. The blood pressure has to be ideal. We need to get it as close as we can to 120/80. If it's not there, that means we're not getting enough treatment. Other things and factors are very important. What's your fasting glucose? What's my current BMI? And how can I get it better? Am I getting enough exercise? So before you go to your doctor, know what your blood pressure is and have it on multiple days. Find out if you're being treated for diabetes or even been tested. And for the love of God, if you have any motivation after hearing this, find out ways to quit smoking. Discuss with your doctor how often you should check your cholesterol, specifically also your triglycerides, and lower your stress level, which is kind of silly to say nowadays because we're all under tremendous stress, but know that it is beneficial for your health to find out ways where you can reduce that stress. Now, the treatment goes in two different aspects. It can be medical, or it should be medical to start with, by treating the blood pressure, the cholesterol, and the blood glucose, but it also can be interventional. If someone's having chest pain that we think is related to their heart, then we should go in and do the procedure that needs to be done, commonly known as heart catheterization, which can be done from the radial artery in the arms, or it can be done from the femoral arteries in the leg. Let's find out if there are any blockages and whether we can treat them with interventional tools that we have that include balloons and stent. The stent is basically a metal mesh that keeps the artery that was blocked open, redirecting that blood flow in a vigorous manner to the heart muscle in the areas that needs it. I have some slides here that I'm gonna tell you about very quickly of when heart catheterization started, and it was all the way back in the 1960s, actually started by Dr. Mason Sones and other doctors such as Dr. Daughter. But the first angioplasty and stent was put actually in the late 70s by Dr. Andreas Grudzing, who later became in the United States. So this dates back to 1977, and you can imagine how much that technology has improved. And the risk of complication from the procedure has dropped down dramatically of any major complications to be less than 1%. That means over 99% of people do just fine with this procedure. What else can stress do? Well, sometimes it's not due to a blockage. Stress can be very, very detrimental to our health. And some people have what's called the broken heart syndrome, where they actually do have a heart attack, and when we go in there to find any blockages, we don't find any. There are specific treatments for that you can discuss with your cardiologist. That's where we do the cardiac catheterization. Hurley Medical Center has actually updated our cath labs with state-of-the-art brand new cath labs with all the needed equipment to do the best job we can. We also provide in the center the cardiac and pulmonary rehab, which does also a wonderful job in patients post-treatment. I wish that those therapies, specifically the rehab, was actually also approved for patients before they get into an event. But that's something you can educate yourself on from your doctor, and you can start on your own at home. This will conclude my presentation. I hope that I've given you a good idea about what your heart is, what the impact of the cardiovascular system on our health, and how important it is, how does it affect our economy and our life, and that there are wonderful tools that we can use to improve our health in that manner. And I appreciate the opportunity to talk about it.
All right, so much good stuff there. Let's get to the live questions. Remember, you can submit your questions by texting me at 248-935-2562 or submitting questions on Facebook or YouTube. Dr. Al-Khattab, Greg wants to know, does my family history of heart attacks really affect my heart health? I'm fit, healthy, and don't smoke. My wife is insisting I get a heart checkup.
That is actually a wonderful question. I think Greg is the one asking. Greg, that's a great question. Your wife is absolutely right. In fact, I bring you to some stories about some of world athletes who are very fit and unfortunately suffered a heart attack because they never thought that they should check. If you remember in the slides that I've shown, one important factor that I said we might not be able to change is our genetic predisposition. So if somebody knows that they have a strong family history of heart disease, they need to know that they have a strong genetic predisposition. Now, what you have done by being fit and being active most definitely is wonderful, and it might delay an event by years. That doesn't mean that it will prevent it completely. So you should check. You should check your cholesterol. You should check if you have any current disease. Not to get into details, it's something that you should check with your doctor. But, you know, like I tell my wife, she's always right. Yours is too.
Melissa's asking, I feel discomfort in my chest, but I think it's heartburn. If it was my heart, wouldn't I have more symptoms?
Okay, so I'm going to refer you to a book that's called Men Are From, where are they from? Men Are From Mars, Women Are From Venus. So ironically, men present like they read the book. It's a clenching chest pain, it comes with effort, it's resolved with rest. Females can have a much, much different presentation that should be atypical. So I don't want to put any doubt or suspicion in your mind. But unfortunately, women do present with atypical symptoms. So you should discuss that with your doctor, and you should not ignore it.
Don't women kind of, I think, you know, I've heard before that, you know, women have so much stuff on their plates, so they tend to, you know, put the stuff off. Oh, it's just this, it's just that. Oh, my back hurts, whatever, it'll be fine tomorrow. You know, they don't have time for all of that. They really need to,
yes,
you know.
Ma'am. Yes, ma'am. Yeah, women are far busier, work harder, much smarter. Anything else?
Okay, as long as we've got that straight. Brandy says she loves Dr. Elkatam, so that's nice. Dale wants to know if he can call your office directly for an appointment, or does he need to go to his family doctor first?
So that's a technical question. Some insurances do not require referrals, and some do. So unfortunately, that's just governed by what the health plan is.
Do you suggest people go on the Mediterranean diet for heart health?
That's a very, very good question. The number one answer is any diet, almost any diet, is good if you stick to it. That being said, the Mediterranean diet is rich in olive oil, which has polyunsaturated fat. It is low in saturated fat. In the right amounts, it's a great diet for your heart. And actually, the American College of Cardiology and the American Heart Association do rank diets almost once a year about how many of them are the most heart healthy, and the Mediterranean is amongst the top.
You know, we see for like mammograms, you should start at a certain age and do it every so many years. Colonoscopy is the same. Is there a timing or a time frame for seeing an interventional cardiologist?
The answer is no. It really should go by one's risk factor. So if I know that in my family, God forbid, you know, somebody has family members who've had first events at a very young age, that means they should start at a very young age. Or if somebody knows that they've been diagnosed with diabetes, or if they smoke, then definitely these are things that should push you towards checking with a cardiologist. But the person that you really should check with before is your primary care physician. They will know if you have abnormal cholesterol, abnormal blood pressure, abnormal glucose. That needs to be changed. So I'd love people to get more into the idea of how do I prevent to not ever needing to see an interventional cardiologist.
Scott is asking on YouTube, what's a cardiac CAT scan and how long is the test and where can you get one?
So there are two types of cardiac CAT scans. One is called a calcium score, and that is a fairly inexpensive test. I can't really comment on where exactly you can get it. There are multiple places that provide it. Many imaging centers have it, and most hospitals do as well, including Hurley, where you quantify the amount of calcium in the arteries that supply blood to the heart. That test is useful only to say, are you a high-risk person, an intermediate risk, or a low risk? Because the test doesn't really look at the inside of the artery. A more specialized test is called a coronary CTA. It takes a little longer, and it requires the injection of contrast. And that test has the ability to look at the lumen of the heart, but there are many conditions. The test has to be done perfectly, one time, slow heartbeat, no movement, and it may give very useful information. It depends on how much calcium there is. I hope that answers the question.
If arteries are clogged, or I guess semi-clogged, could you turn that around with diet and exercise, or is the damage already done?
It's a great question. There is one single clinical trial that has shown patients who go on a very, very, very strict vegan diet have shown reduced areas of ischemia, decreased blood supply. Of course, that's coupled with exercise and not smoking and positive attitude, so forth and so on. Secondly speaking, there are trials that have shown certain cholesterol medication to reduce the burden of the plaque and improve the lumen of the artery. So, like I said before, it's all about hope. I think the word "is it too late" should never be said in cardiovascular medicine.
Okay, that's all of our questions. Thank you so much, Dr. Alcatab.
Wonderful. Thank you so much for this opportunity. I appreciate it.
We hope you join us Wednesday, March 23rd at 3 p.m. for Dr. Paul Telehowski's Healthy Living event on joint replacement and how the ROSA robot is helping patients heal quicker with more comfort. We do want to thank our great production partners, Mid-Michigan Now. Have a great day, everyone.